right, so here we go. You ready? Here's our experts. They have their microphones ready in hand. And so we're going to get started with our expert roundtable. I know this is a tough subject, so what our focus is today is to focus on solutions and questions and answers that are practical, that we can implement. A lot of this stuff can cause some frustration, so we're going to try and be as focused as we can and stay on our goal and stay on subject. All right. This is going to be town hall meeting style. We have several experts here to help you with your specific needs and questions, whether it's for your client or for your own firm. The more specific details you can give us, the better that our experts can assist you. To ensure we get as many case scenarios as possible for us to learn from, we ask that you be brief, yet detailed in your questions. Gary, where are you at? Gary's in the back of the room. Gary's going to assist me in determining the best expert for each question and ensure that you have your questions answered. So between Gary and I, we're going to keep us focused and on goal. So let's get started. I'm going to briefly introduce our experts so you know a little bit about their background. Rosemarie Day is with us today from Massachusetts, where reform all started. And we thank her. See, it's already started. We're going to have a hard time, Gary. And she was instrumental in the formation of the Massachusetts Exchange, and she's also well-versed in the language of law in the political landscape. Give a little small wave, Rosemarie. Okay. Larry Grudzien, who is also our class clown today. Teasing you, Larry. Larry's a well-respected attorney joining us from Chicago, Illinois. He is well-versed in the law of ACA and has helped many of our members in the MBPA implementation reform among a vast array of his circle of influence, and he's quite famous in his own right.
Go Cubs.
Whoa.
Listen.
Did you see the basketball game? Was there an Illinois team in the Final Four, my friend?
Listen, we know they lose, so what?
Oh my gosh. All right, it's going to be rowdy. All right, Don McAnelly is a certified public accountant and in the in-house reform expert at Raymond. He's well-versed with the tax provisions of reform and their impact on financials for his clients. Don? Wave. All right. You probably have already met Chris Priest. Chris is Michigan's go-to point person for reform. Chris is the lead liaison with all critical departments for the implementation of reform in Michigan, and he has been instrumental with identifying how Michigan will adhere to the ACA, including Medicaid expansion provisions. Fun. Kristi Gauthier. Kristi is with the law firm Clark Hill and is their in-house go-to expert on reform. Kristi has been instrumental in the MBPA's tools and resources, you may recognize her, to assist members in understanding and implementing reform. Little wave, Kristi. Okay, and Alisa Bennett. Alisa joins us from Blue Cross Blue Shield of Michigan. Alisa is responsible for implementing and shaping the Blue's strategic plan to implement health reform, which sounds like fun, as well as to ensure the proper communications with all stakeholders. Alisa? And last but not least is Marisha Taylor. Marisha joins us from BASIC. She got a hoo-hoo out there. Good for you, Marisha. Joins us from BASIC, a national but Michigan-based third-party administrator that works with employers for their compliance with such laws as ERISA, HIPAA, COBRA, and now the ACA. All right, so let's get started. Okay, so to make this a little bit more fun, when we sent the confirmations out for our event today, we said, do you have any questions you want us to ask in advance? So what we're going to do is I have some questions that our members have written in, and Gary's going to be walking around the room. So if you have a question, raise your hand. And okay, we have one here, and Melissa. Okay, so we have one here, Gary, and one here. So let me start with the question. Let's start from the field. Let's start over here, and then over here.
Thank you. Good afternoon. My name is Alan Sefton. I'm just curious. I'm an agent, and I have a client that is a restaurant chain, and I know in one of the sessions there was a restaurant owner, but they have like 7 different chain, restaurants throughout this area. Most of the employees are part-time, and I'm just wondering what your thoughts are in reference to how they could address it. I had mentioned about changing their renewal to move it ahead. So I'm just wondering.
How many employees do they have in total?
About 80 per restaurant, and they have, I think, 5 or 6 locations.
Because of the nature of the business, that restaurant probably doesn't comply with the transitional rule. So therefore, they have to worry about healthcare reform as of 1/1/2014. Now, the first thing they have to do is determine what portion of those part-time employees are full-time. So they have to do a measurement period, and I would suggest very strongly they start measuring people in October 2012, because their administrative period to sign up has to be in late 2013. And I would suggest that their measurement period be at least 12 months in order, because in that sense, the part-timers would have to work 1,560 hours to be full-time. Now, in working with restaurants, one of the things I realized that even though you have an obligation to offer coverage, the employees don't have an obligation to take coverage. And many of those individuals are covered by their parents' plan or other plans. And my experience has been that very few of those full-time employees are going to actually take coverage.
Yeah, no, I agree with that wholeheartedly. I mean, the key is you have to offer it, but they're going to have to comply one way or the other. He had mentioned the transitional rule, and by that meaning, you have to have certain thresholds in order to take advantage of a delayed effective date if you're a non-calendar year plan. But the best thing to do is start measuring. I think a longer measurement period, because you have a longer period to average over, is really the way to go.
One of the issues that I, as a CPA, have seen is that clients have come to me and with situations like this where they might own multiple different businesses. And I'm going to go there, guys. I'm going to mention an IRS code section, 414. No one's left the room yet, so we're doing okay. When you mention that sort of thing, generally people get up and dart out pretty quick.
Are you talking about B, C, or M? No.
But there's some questions out there that people will have. They'll come to me and they'll say, if I have separate businesses set up, can I avoid this? And the answer is no. That's a question that I regularly get. If you're a business owner that owns multiple businesses and you want to provide coverage in one but not the other, no, you're going to need to aggregate your employees together there. So I just wanted to throw that out to the room too.
But I think one thing's important also too. You aggregate them to determine whether they're a large employer. But in the application of the penalty, what the IRS did in December was it can be applied separately to each member of the control group. Which means if you have 3 businesses and 2 businesses decide to offer coverage, the third one does not, only that separate member of the control group will be penalized, not the other 2 that are offering coverage. And that was something that they came up with in December of 2012. So here, if you have a business that has various businesses and you decide that you're going to, for one reason or another, not to offer coverage in one location or one business, it doesn't mean the whole control group is going to be penalized.
Okay, can I add to that question, because this was one of the write-in questions. It was very similar. The question is that they have their employer, and many of their part-time employees work less than 4 months per year. So how would those companies count their employees?
Well, in that situation, if you work less than 4 months, to determine whether you're a large employer, there's a special exception under the regulations. So let's say you run a series of Dairy Queens, and you usually have 20 or 30 employees during the year, but for 4 months out of the year, you have 200 employees. If they work 4 months or less, in determining whether they're a large employer, those seasonal employees would be ignored. And therefore, those Dairy Queens would not be considered to be a large employer.
Okay. Melissa, we'll go to you.
Hi. My question is kind of adding on to that question. So if I have an employer that has, say, 5 companies, it's a husband and wife, the wife owns 2, the husband owns 3, I know you said that they have to be counted together for the over 50 rule, but if there's 100% owner in part and 100% owner, can they take them apart or no?
You know, the control group rules are pretty complex under the code, and if you're talking about husband and wife, there are spousal attribution rules you have to consider. In other words, 100% owned by a husband and 100% owned by a wife, they'd be lumped together. Yeah, there's a lot of attribution rules, familial and otherwise, that you have to consider. It really is a complex analysis when you're determining control group, but you are looking at common ownership.
And there's also attribution in some situations to the kids, but there are very specialized rule in that. But it's very clear between husband and wife, they're always treated as owning the interest of the other spouse.
Gary?
We have a very similar but slightly different question.
I'm with a community college, and we're trying to deal with the adjunct faculty issue. And one primary concern, we have quite a number of adjunct faculty who have been working at 3/4 of what the regular faculty have been and more. And our summer semester, our breaks, we don't have any breaks that are 26 weeks or more. It's my understanding from information this morning that we cannot use the semester breaks to help average out the number of hours they're working. Is that correct?
The educational institutions do have special rules for breaks in service. Employment breaks, it's a break greater than 4 weeks and less than 26, I believe is the rule. But you have to average out. In other words, you're not using the summer break for an educational institution to penalize an employee. If they've been working full-time and then they go out on summer break, you're not crediting them with 0 when you're averaging, in other words, to bring them down. And there's some specific rules on how you credit hours, if you will, to basically keep them at full-time status. But adjunct professors prevent some unique challenges when you're determining how to, I can tell you want to comment on those, so I'll let you with respect to adjunct professors.
There's no guidance at all. I mean, the issue and problem is...
Reasonable. Be reasonable, that's what they
yeah,
said.
I mean, they basically, the IRS says, well, use any reasonable method to determine their hours. And I used to be an adjunct professor, and my God, I worked 300 hours a semester. 400. But it's going to be a challenge for colleges to determine, in actuality, what the actual hours that an adjunct works, depending on the courses they teach, depending on the topic, depending on the time of the year. And there's no answers from the IRS. I mean, there's none. I mean, so you have to come up with a reasonable method to determine and estimate, because it's not just teaching time, but it's also preparation time and also the time to come up with testing. So all that's got to be considered in determining how many hours an adjunct professor takes in order to teach a class.
And it's very clear in the preamble that you cannot just credit the hours in the classroom. That's not considered reasonable. So you obviously have to consider some of the preparatory time. Again, the guidance ends there, but they do say that considering just classroom time is not considered reasonable.
Okay, we have a write-in question, then we'll go to Melissa. Realistically, let's discuss costs and products both on and off the exchange. What can we really expect over the next 5 years related to rates? Let's do Blue Cross. Let's go to Blue Cross, and then let's go to Basic from an employer perspective. And then let's go to Massachusetts and see what happened to rates after that.
That is the magic question. Everybody wants to know how much it's going to cost, and unfortunately, I don't know. I can't tell you what the rates are going to be for next year, and it's going to be variable based on the group and their size and a number of factors. Yes, we can say with some certainty that some will experience an increase, but there are actually some, and don't see me after, but there's some who may even experience a decrease because there's been so many changes in the underwriting rules and so forth. So I don't want everybody to walk out thinking, oh my God, I'm going to see double-digit increases. It's really kind of all over the map. There are some groups who may experience those kinds of increases, but it really is kind of a wait. We have to wait and see until the products are ready to roll out.
Alisa, what about individual rates? So we're talking group. That was a group question?
Yes.
Were you answering for group or individual?
That was for group. For individual, we can say with some certainty that they will see increases in the cost of coverage that they've seen in the past, just simply because there are essential health benefits that are guaranteed as part of every package. We've had to make sure that all these plans are designed in a way that complies with the law in every aspect. So they'll have, in a lot of cases, richer benefits than they've experienced in the past in the individual market, but there will be a cost for that.
Okay. Do you want to answer, Chris, do you want to chime in on this as rates and maybe
No,
the
I mean,
Medicare?
basically, a lot of the benefit package, especially in the small group market, to where essential health benefit applies, I mean, it really is similar. I mean, it's to what's been out in the market today. There are other rules and things that will impact price at some level. I think we all expect that. But really, if you're looking to see where a lot of the larger rate increases will come, it will be in the individual market. And that's a function of just, like they said, larger benefit packages coming through. But a lot of those folks will go to the exchange, and a lot of Michiganders are going to be eligible for tax credits on the exchange. So while their costs, while the premium may increase, they may actually realize a decrease in cost compared to what it is today as a function of them receiving that tax credit. Particularly those, quite frankly, who are below the ages, probably between 45 and 65, right before Medicare, they'll probably see richer benefits as a result of some of the rating rules and other things. Just on a percentage basis, they'll probably see deeper tax credits and stuff than others. But I think that group is a little squirrely. I think it really is a function of where you are, what your model is, where you're buying from, how you're buying. Individual is really, I think that's quite frankly, especially in 14, that's going to be where a lot of the action is, because you're going to have this influx of uninsured individuals into the individual market.
Okay, and then Rosemarie, Massachusetts, what happened?
So we had the crazy situation in our individual market of our rates actually went down when we first implemented reform, because we were one of the handful of states that actually had guaranteed issue of insurance with no individual mandate. So because of the guaranteed issue, most of the people buying individual coverage really needed it because they had a health condition. So the individual market was actually expensive. And when we did reform, we brought in more of the young, healthy people, and therefore actually the overall rates went down. So we were fortunate to have a good news story. That is not going to be as much the case in other states because you're kind of doing it all at once. I think that's true in Michigan. On the small group side, we saw rates, there was nothing in our law that like magically lowered rates, but they didn't like skyrocket. There were news stories of some increasing rates, but that tended to be specific to a group that was probably tripping the age bands and had, you know, individual situations that led to their whole group experience kind of going up. Our reform didn't address it, but we are trying to address it now because our rates have just continued to go up. Our reform did not cover the goal of getting to affordability. So we have another reform that passed last summer, and we are trying to tackle that part now to bring more affordable options to people using narrow networks, things like that, that will help people, including small businesses, get to more affordable insurance.
Okay, back in the back, Melissa has someone with a question.
Somebody said earlier that employers only have to pay for coverage for the member, not dependents, and then that spouses are not considered dependents. Can someone elaborate on that, please?
For purposes of affordability, I think that's where you're talking about. Affordability is based on self-only coverage. You're taking 9.5% of one of those thresholds or the household income. You're looking at self-only coverage. Affordability does not extend to dependents. And what I'm saying is, for purposes of the penalties, you have to offer coverage to dependents, and dependents is defined as adult children up to age 26. Interestingly enough, it does not include spouses. But when you're assessing the affordability based on that coverage, you're looking at self-only coverage, and therefore an employer can charge 100% to the employee for the dependent coverage, and that's not going to trip affordability because you're looking strictly at the employer.
Now, a very important fact that we talked about earlier, which is something that many people don't realize. If you offer affordable coverage to the dependent, to the employee, don't cover the spouse, and offer coverage to the dependent, what happens in that circumstance is the family, if they go on the exchange to purchase any insurance, will not get any credits and subsidies. Please remember that. I mean, that's going to be an interesting scenario when a family realizes, well, you just offered coverage to my husband, but I don't get any coverage. I mean, if I go on the exchange, I have to pay full freight, and I'm going to include my kids, and I don't get anything. That's true. So that's something that's, and the reason why they did that is they looked at what the credits and subsidies give and said, oh my God, this is going to be extremely expensive. How can we limit individuals in getting a credit and subsidy? And that's what they came up with it. Okay. So please remember that. So as long as you offer affordable coverage to the employee and offer it to the dependents, the whole family is barred in getting anything on the exchange. They have to pay full freight.
Gary?
Thank you, Jennifer.
Hi, my name's Steve. I don't know if you guys heard about this. I'm pretty sure you have. Part of this law is actually fallen apart, which is amazing. And it deals with the exchange or the shop program for small businesses. The individual mandate's gone from 2014 to 2015 because there's not enough time to set it up properly. How's that going to impact small businesses that would normally buy from the exchange if it's just, is they going to keep it status quo? What?
Go ahead, Chris.
So on the individual mandate, that's not true. The individual mandate is in place starting January 1st, 2014. On the shop exchange is going to exist. It is going to be run in Michigan by the federal government. The piece that is not going to be functional is the ability to do what is known as the employee choice option. So as a small business, part of some of the promise of the functionality that was supposed to be included as part of the exchange for the federal exchange is the ability to give employees more choice in the products that they have. Today, if you as a small employer, you offer everyone a Blues plan or an Aetna plan or well, not Aetna in Michigan, but a United plan or something like that. Well, the employee choice model would be given you the ability to do a defined contribution and for the employee to basically shop on the metal tiers between carriers, and the exchange would aggregate premiums to those carriers for you. That function will not be available for the first year. So that's the piece. So if you're a small employer, you're likely going to go to the exchange and you want to use the exchange and take advantage of the tax credit. You're going to go to it, and in all likelihood, you're going to be able to pick a plan for your employees, and that's it. Really, that's the thing. Now, I do believe that there are other things that are coming we don't know about yet, but because a lot of the design of the federal exchange has been, what's the best way to put this, Rosemarie? Like, in a black box. We really don't know exactly kind of what functionality will be up and running come October of this year, which, oh, by the way, is a few months away.
I would imagine we're going to hear probably in the next 2 to 3 months the future of the exchanges and how they're going to work and everything else, and whether they're, because remember, in all of this, the government, the Obama administration has to get this done. They have to get the exchanges up and running because remember, there's an election coming in 2014. And if they don't have those things up and running, and if they're delayed until 2015, there's going to be a political price that the administration and the Democrats are going to pay if it's delayed. So for all intents and purposes, as I indicated before, they're going to get something up and running in 2014, because once it's up and running, it's going to be hard to take down. So, I mean, if you would have asked me 6 months ago whether it's possible, I would say no. But more and more I've been hearing they're feverishly trying to get all this done. And remember, the feds have to put in a federally facilitated exchange in about 33 states. So it's going to be a huge endeavor for them to do this.
Do we know which kind of carriers are going to be on the exchange? I'm going to go to Blue Cross and then Chris. Well, let's start with Chris and then go to Blue Cross.
We don't yet. The QHP certification process has just started. Mm-hmm. There's a window over the course of the next couple months that they'll be filing their rates and their forms. So there is going. I don't think we have an idea exactly yet. We do know that there will be some multi-state plans that will be offered on the exchange. That is still in process at the Office of Personnel Management and Budget. I think it's safe to say that our largest carrier will be offering. I think that some of our larger carriers, but not everyone will. I mean, we've already heard from Health Plus. They will not be offering qualified health plans in the state of Michigan. There are, and it's quite possible that some others might choose not to participate also. So, that's one of those things that's stay tuned.
So we have some people in Michigan not being on the exchange and people from outside the Michigan going on the exchange, correct?
Well, you definitely have some Michigan carriers today who will not, I mean, like Health Plus is a perfect example.
Yeah.
They've already announced they're not going to.
Okay.
But you will have these multi-state plans, however they get sorted out, to be offered in the state. But how that is officially done is to be determined by the Office of Personnel Management in the federal government. So that's going to be a little unique. And we also have a co-op health plan that's starting in the state of Michigan that's also required to be offered on the exchange. But that's, you know, we haven't seen exactly how they're not licensed yet. So that's still, they're still a kind of a startup.
Great, thank you. Alisa, do you want to comment?
Sure. Blue Cross will offer products on both the shop and the individual market. We're going through the qualified health plan process right now, so we'll know soon, in a couple of months, which of our products will be available, but we fully intend to participate on both the individual and shop exchange. Those are alternative distribution channels. We'll still continue to offer coverage in the ways that you've acquired it before in the past. So,
okay, go ahead, Rosemarie.
And I would just say, sort of setting politics aside, there's kind of a reality with launching these exchanges. It's just, there's a complexity to it, and particularly if the feds are trying to do it across all these states, it's an order of magnitude it's pretty huge. I think what you see this fall is not what you'll see a year from now or even after that. There's an evolution, and even in my tiny state of Massachusetts, we started with something and we learned an awful lot from our customers right off the bat about what was working and not working. So even the kind of innovative state exchanges that are doing their own thing and they think they've got it figured out now, they're going to learn after they launch that, okay, that actually isn't working, and they're going to want to retool. So I think there's going to be this evolution. They're going to focus on individuals. They'll then start to turn their attention to small business, I think, because they've got to triage the priorities. But it's not just a static thing, and they will be looking for input from consumers.
Okay, we're going to go to Melissa. If you have a question, please raise your hand. Okay, there's a few here. Melissa, with yours.
Okay.
And then we're going to do a write-in question, then we'll hit some of these folks over here.
Okay.
Yes, Dan Langeway. Just as a follow-up to the college and university question with adjunct professors, is it reasonable to consider 1 hour class time for 1 hour prep? Taking a 3-hour class would equivalent to 6 hours, and then not having them teach more than 4 hours, which would be 24, which would keep them under the 30 and ineligible for benefits. So really it's the 1-to-1 is what my client is looking at right now as reasonable.
What is it based on?
Experience.
As long as you can justify it, I have no issue or problem with that, but it's got to be based on actual reality.
Anybody else want to weigh in on that? Marie?
I agree.
Okay, all right.
It's like dancing in the dark.
All right, I'm going to go to some of these write-in questions. There's 3 similar questions here related to avoiding the ACA. So we heard this morning that in one of the sessions that you can change your SPD plan year to 12/1. By the way, MBPA offers SPD services free to our members. So just wanted to mention that. But also, there's a lot of talk here, questions related to incentivizing full-time employees not to take the insurance. So in this one example, they say, can I incentivize my full-time employees not to take our company health insurance, assuming it is quality coverage and meets ACA requirements? It might be cheaper for me to offer insurance, which I currently do not offer, to my full-time staff and incentivize them not to take it than pay a penalty. And then this other question, can a company circumvent the ACA requirements by not offering a group health plan and having employee purchase individual health insurance coverage at the employee's expense and giving those employees a stipend to cover part or their individual health insurance costs? So people are trying to avoid this thing. And then the follow-up question, with someone like Blue Cross, will you allow those things to happen? So who wants to go first?
Jennifer, what was the first question again?
First
there was
question.
3 or 4 there, and
The first question
A, B,
is,
or C?
Can I
Yeah,
incentivize my full-time employees not to take our company health insurance?
So you've got a large employer that presumably offers affordable coverage with minimal essential benefits, and is then saying, can I incentivize them to not take our coverage? I look at that as an economic question to the employee. They're going to have, there's an individual mandate. They're going to have that employee's going to have coverage. If their spouse doesn't have coverage for whatever reason, their spouse's employer they might have gotten coverage from before is not mandated to provide you with any coverage right now. So to me, I don't see how that's going to work. Someone's going to have to then go out onto the exchange most likely and get coverage at that point in time. I'd be interested to hear what other people on the panel think.
Let's look at this situation. This has been posed to me. 2 or 3 different situations. An employer approaches an employee and says, if you take coverage, you get $10 an hour. If you don't take coverage, you get $15 an hour. That's one situation. Somebody comes to you and says, I want to work more hours, and if you give me more hours, I will sign the waiver that I don't accept coverage. So what do you do in that situation?
Well, you post the questions and I answer. Well, I certainly don't think, first of all, I wouldn't advise tying taking coverage and not taking coverage to upping wages, and I just wouldn't do it via wage.
But
there's nothing saying you can't. There's nothing saying you can't. It just sometimes you have to go to common sense smell test, and that doesn't pass it for me as an attorney. I'm sorry I have to say that, but I have had that same question be posed. You're right. There's nothing in the regulations that says you cannot do that. Perhaps think about doing a bonus opt-out. We're offering you the coverage. We'll throw money at you. We'll give you $1,000 a year if you choose not to. Many employers do that today, and those are not going by the wayside. You can still do a bonus opt-out. For some reason, I just have to go with my gut and say I have advised that I'm more comfortable going that route.
And the only thing that the regulations say, there has to be an offer of coverage, and the employer could argue, I did offer that employee coverage, except that it was tied to a lower rate of pay. And what the government's going to say is that a really good offer of coverage by tying it to a higher, and that's the open question right now.
Right.
That's the open question. We don't know what the IRS is going to say in that situation. And I agree with you. I think if you want to avoid that situation, avoid that at all costs. But if a client wants to take a little bit of risk, okay, take it, but understand that it's not clear from the regulations yet.
Yeah, I agree. And then you had mentioned signing a waiver. I mean, that's not going to get you out of penalties. If you have someone sign a waiver that you're offering them coverage, I just don't see that's going to be a way to go.
And that employee 6 months later gets fired, and guess where they run to?
Exactly.
Yeah. I can see a lot of employees saying they were under duress to sign that waiver, and there'd be another whole different attorneys advertising at Channel 50 at noon or something.
And I just wanted to add that we actually at Blue Cross, we expect that there may have been some small employers who would opt to drop coverage because there is no penalty to them to do so. We don't expect a lot of that to happen in the large group space, but we do have a process to transition if they are taking that approach of dropping coverage altogether, so that we can transition those employees to the individual market in a concerted way, so they're not just kind of wandering off on their own and feeling kind of lost. I think it sends a different message too to the employees that maybe my employer doesn't care about me so much if you drop coverage and you have offered it in the past. So it becomes important to have those conversations with your employees if that's the intention that you're going to kind of get out of this thing altogether and say, I'm not going to offer coverage to my employees. You're sending a message to them, whether it's verbal or nonverbal, and you need to probably have that conversation and look at how do you transition those employees in a way that makes them feel like you had to make that choice for financial reasons, and here's what we're going to do to make sure that you're assisted in the process to the individual market.
I should probably have the lawyers give the details of this, but there's also been some recent guidance around the use of HRAs and whether that benefit could be used to purchase insurance on the individual exchange. So basically, can you use some pre-tax dollars for that? And I believe it's no, because again, I think the feds are trying to not completely undermine the current group market, and so trying to not create extra incentives to shift everybody over to the individual market.
In the small plan market, there's 2 factors that are real important. One, if your plan is non-grandfathered, there's a requirement that your deductibles are $2,000 for single, $4,000 for family coverage. And what the IRS has indicated, you can't use HSAs, you can't use HRAs or HRAs to get down to that level. It's got to be pure insurance. And secondly, which is very important, is the government said too that there is guaranteed an insurance company has to take you in the small plan market, but if your participation is low, they can actually throw you out after a period of time. So there's no guarantee renewability under the law. So that's extremely important. So I mean, there's some rules here that apply both to the large plan market and the small plan market, and I think the reason why their costs are going to go up in the small plan market, because the deductibles are now $2,000, $4,000, and many small businesses, it was not unusual. And now in my practice, I have a $5,000 deductible, and now I have to go next year and get a $2,000. Well, that's not going to be cheap. So there's going to be increases in cost because the coverage is going to get better, but at what cost? That's the problem.
Marisha, your company offers HRA services. Do you want to add to this at all? And what you see your clients doing?
Sure. Well, with recent changes, definitely a lot of employers have kind of looked at their HRA plans and kind of developing a strategy in order to comply with healthcare reform. Like Larry indicated, for sure you cannot offer HRAs if they're going through the public exchange. Those are some of the types of things that we're communicating to our employees through our webinars and things on an ongoing basis, as well as in making sure you're complying with the deductible limits. Again, we're spending a lot of time communicating with our groups as well.
Okay, Gary?
Yeah, I have a question. I'm an employer. Can I offer 3 plans, bronze, silver, and gold? And I got employees making $100,000, employees making $15 an hour. Say the person making $15 an hour, single, female, no kids, no spouse, and she takes the gold package, and 9.5% of that price.
It's based on the cheapest plan. It's not based on the gold.
Ah, all right.
Now, one thing is going to be very interesting to employers, and I get questioned about the employers. You mean under healthcare reform that my higher paid people are going to pay more? I went, yeah. Is it going to vary for each employee? I went, yeah. Isn't that discriminatory? Yeah, against the higher paid people, but that's the whole point. The whole point of it is that the lower paid people are going to pay less of a cost than the higher paid people. And it's reverse discrimination. In the corporate world, we used to call that the Robin Hood approach. And here it's going to be nationwide now. So, I mean, that's the policy.
Okay, Melissa?
Mike Mostyn. The question I have is for a large group and the affordability portion of the law. If you have a group that renews, say, sometime in 2014, does the affordability portion start for them at their renewal date, or is it January 1st? And I was thinking more about, you have somebody who goes on January 1st to the exchange, and if, can they get the subsidy if it doesn't apply yet, and how that works?
I think, the affordability provisions kick in on January 1st, and I'm not aware that you'd be able to delay until the plan year. Are you, Gary?
No, but I mean, you're not going to be penalized.
No, right, exactly, right.
So can the employee then get the subsidy, and there's just no penalty for the group until their renewal date?
Correct.
Okay.
Now you say to yourself, why would they create something like this? It gets so complicated. And the issue and problem is that everybody's facing this because, we talked before the seminar, and we're saying, it's every day I find out things I don't understand or remember, just to deal with this is an extremely complicated, convoluted exercise. And so please don't feel you're alone. Even though we deal with this on a regular basis, it's very frustrating because I forget things, and talking to clients, sometimes I have to call them back. I forgot about this.
Oh, there's rules upon rules and exceptions for exceptions, and I find in dealing with every employer that every situation is unique, and there are so many little nuances built into these rules. I mean, these are thousands upon thousands of pages of guidance that we're trying to sort through. So, like I said, every employer, it's not a one-size-fits-all rule, unfortunately, and it really takes a lot of work to work through them and find the rules that apply to you, and then put together a plan of action that'll best fit your needs for compliance.
Now, in 2014, the person you should get up and close and personal to is your accountant, because in 2015, every large employer will have to fill out a schedule indicating what their health coverage is, and that's going to be important to determine whether you're going to be penalized by the IRS. So depending on how your accountant fills out that schedule is going to determine whether you're going to get a friendly letter from the IRS, whether you're going to be penalized or not. So please make sure you understand all the reporting requirements that will come into play in 2015 for 2014. And those rules have not been released yet.
Exactly, Larry. Thank you for the commercial there. And
I'm not making this up.
that is a big issue for a lot of the businesses out there, a lot of the employers out there, is that there's a lot of these regulations here. Let's face it, we're plowing new earth here. And there's a lot of these regulations out here that are forthcoming. And I know all of us are out here looking for answers, wanting to find out how this act is going to directly impact us. True answer is, just like Larry and others have been saying here, is that, the regs are coming out slowly but surely. But there is going to be that reporting in 2015 that's going to be something that's going to hit all of us as employers. It's going to be really important that everyone gets that reporting done correctly to try to avoid some of the love letters that will be forthcoming.
So
just to give you, I'm doing a seminar for one of my clients, and it's changed since December of 2012. It's an hour and 20-minute seminar from December 2012.
So we're plowing new dirt. Here, wait, do you have a follow-up? Somebody has a follow-up? So let's say that. Gary, can you get her a microphone? Hang on a second. There you go.
Well, Rocky, can you ask a question for me?
And the question that he asked over there about the renewal, if that group had 200 employees, let's say, and only 25%, less than 25% had the health insurance, then they would have to, the mandate would have to start January 1st, am I correct?
Correct.
But you told him...
Well, I assume the fact that they met the requirement for the extension.
Okay.
Are you stunned?
I think there's some confusion. Are you good? Did you get your question answered, or is there some follow-up confusion?
The group would have less than 50% participating. I would think it'd be more than 25, but less than 50%. And they would not be hitting the numbers at this point, I'm sure of it.
For the transition, you're talking about the delayed effective date for the penalties?
Yes.
Okay, so let me just state the rule so I can make sure we're all on the same page. So generally, these provisions go into effect January 1st of 2014, as we all know. Someone who's operating on a non-calendar year, you could potentially have a delayed effective date if you meet certain criteria, and that plan has to be in effect as a non-calendar year plan on December 27th, 2013. 12. It's December 27th, arbitrary date, but that's what they chose. So your plan has to be in place, and then there's two additional criteria. It's an or criteria. You have to at least offer coverage to at least a third of your entire workforce, full-time and part-time employees, or you have to cover at least a quarter of all of your full-time employees and part-time employees. So it's a third offer, a quarter cover. If you meet those thresholds, then you are potentially eligible for a delayed effective date, meaning that the penalties would not be assessed to you until the first day of your plan year beginning on or after January 1st, 2014. If you have a July 1st plan year, you would be assessed penalties potentially assessed penalties as of July 1st, 2014, but you have to meet those criteria.
Is that full-time eligibles or full-time? I mean, full-time and part-time eligibles?
It's your whole workforce. As far as the quarter and the third threshold, it's a third of your full-time and part-time workforce. It's really your whole workforce. You have to cover at least a quarter or offer at least a third to your entire workforce.
Okay, I think that cleared it up. Everyone feels better? Okay, we have a question over here, and then the table next to you, Gary, too.
Okay, Sherry Reggiani, small business employer. We were told we are all heard on TV, that if you were covered now, if you had a health care plan, you could keep it, i.e. grandfathered. But then we heard something different this morning. I'm asking specifically about Blue Cross's wonderful Young Adult Blue, which is a very affordable plan. What can you answer on that? And then a second part to that, how does any of this dovetail into workers' comp in Michigan?
Okay, so we're grandfathered plans for Blue Cross.
So this morning, the question was asked at the end of our session, and let me make sure everybody heard this part, that for fully insured business in the small group market, Blue Cross Blue Shield will not allow grandfathering for those plans. We are at risk. So it is not going to be our practice to allow plans. All of those plans have changed. All of those products have been modified to become healthcare reform compliant. If there is a self-funded customer who is in the large group space, they will be choosing from a different market. They can continue to grandfather as long as they don't make any changes and as long as they follow the guidelines that have been established already around grandfathering. So I'm hoping that clarifies the question that was asked earlier. I don't have a comment about workers' comp.
So that's 2 to 99 in the small group market, no grandfathering. And then 100 plus, there could be grandfathering.
So groups over 50
are
actually now considered large group. So if they're choosing from that large group product portfolio, then they have different options available to them. But grandfathering is really for self-funded groups. If they're fully insured, Blue Cross is at risk. So we're not allowing grandfathering in those situations.
Now, one thing also is a growing trend over the last 2 or 3 years is that many employers are considering going self-funded or self-insured. And before, we used to tell employers you had to be at least anywhere from 200 to 300 employees to consider self-funding. Now, people are looking at self-funding even for groups under 10. And I just want to warn people, and why don't you chime in here, there's increased risk involved when you go self-funding. You have to be more involved employer, you're going to have more risk, you have to be more hands-on to really consider self-funding. Because remember, one of the beauties of an insured product, you throw everything to the insurance company, and it's their dime, their issue. If you go self-funding, you're going to have more risks in providing benefits. So please be very careful in considering it.
No, I agree with that wholeheartedly. I mean, the risk goes up, your fiduciary liability goes up, there's just getting down to the nitty-gritty administration, it could go up. You have to be sure that you have all the ERISA-compliant documents. To me, anytime I'm dealing with not that fully insured plans don't, but anytime I'm dealing with self-insured, I mean, it's just a higher level of awareness that employers need to have. I mean, the buck stops at your door, not at the insurance carriers. So it certainly is something to consider.
And with self-funded groups, a lot of the regulations specifically say it is the self-funded, the group sponsor, it is their responsibility. In the case of taxes and fees, they will have to remit several of those taxes and fees directly to the IRS with no support from their carrier. So, and that's based on the regulations. As much as Blue Cross may want to help, the regulations state it is the responsibility of the self-funded employer to do that. So that's also a consideration. We will be modifying the types of group, the size of groups that are able to have self-funded arrangements at Blue Cross, but not necessarily down to 10. It'll be more like 25, but it's an option that's available, but I would agree with the other panelists about taking caution before you jump into that approach because of the increased level of responsibility and risk.
Okay, I have a couple write-in questions here. What happened to the Cadillac tax? Is it going to die? Don, as our new best friend, want to take that?
You know, it was nice coming to the Metro Detroit area to find that they did use the term Cadillac tax and not make it Lexus tax or something like that. I appreciated that one. No, that's still out there. It's going to be a tax in 2018, I believe, and it's going to be on family coverage costs that exceed, I think it's $27,500, and singles at $10,500. I think it's a tax on the amount that exceeds those levels as well. As I understand, that's 4 years away right now, which might seem like an eternity. I remember when the act passed about 3 years ago, we thought it was an eternity to get to that point. So, I mean, some people are kind of concerned about the Cadillac tax. Many are saying, boy, let's just get through 2013 and 14. And then I've had some people say, boy, how can we avoid the Cadillac tax? And And I said, whoa, slow down there, Junior. We got to get through 2013 and 14 before we start worrying about paying that luxury auto tax. So.
There's going to be, especially if you're in a business that has collective bargaining agreements, remember you have to start worrying about that tax early, because especially if you have multi-year agreements, all of a sudden it's 2018, you can't change anything, and all of a sudden you're subject to the tax.
A couple things piling onto that one. The Cadillac tax, it is an astronomical tax. It's a 40% excise tax. I encourage employers often when I'm counseling them to take a look at those numbers. They seem high, 10,500, 27,500, if that's the accurate numbers. Those are 2018 rates. Take your rates today and project those out a few years and see how close your plan's going to come to those numbers. I think you'll be shocked. When these first came out, a lot of employers said, no way, that's not my plan. I've had a lot of clients, when they run those numbers and start projecting, they're coming dangerously close or crossing that threshold. So in counseling, I often tell my clients, start thinking about that now. I know it's 2018 and a lot can happen between now and then. I realize that, but start thinking about it now. If you have a Cadillac tax, potential Cadillac tax plan, think about possibly ratcheting that down over the next couple years so it's not such a blow to your workforce. And also, I always counsel, and it's easier said than done, if you're working with unions and you have the opportunity to put some form of a reopener in your collective bargaining agreements, for healthcare reform purposes, limited reopener. It's been a golden tool to be able, because there's so many unanswered questions right now. If you have the opportunity to reopen negotiations for even a limited purpose on healthcare reform, it's invaluable. Again, it's easier said than done, I know, but it's something worth trying.
I think an area in Michigan that'll really be interesting is in our local units of government in our school districts, who have traditionally had very rich benefits, if you will. And in particular, school teachers who have really fought hard to keep their MESA coverage. It'll be really interesting to see what happens to those premiums in some of our school districts and our local units of government that are equally being stressed right now. So that's going to be a big item, I think, in 4 years when it does come around.
All right, we only have a few minutes left. We're going to go like 5 minutes to 10 minutes, and then we're going to adjourn. We have two questions, one here and one with Gary, and then we're going to call it a day. Go ahead, Wendy.
Okay. Thank you. Two quick questions I want to go back on. They've been telling us that our groups can keep their rates until their next renewal, but what I've been hearing from you is that January 1st, we have to comply. So I'm confused as to, does keep the rate mean keep the old plan? Or are the plans all changing January 1st? I don't understand how that works. And then I just want somebody to comment about dependent care, as far as I understood that the employer didn't have to pay for it, only offer it. There you go.
You're right. I mean, the employer's responsibility to the dependent children is to offer coverage, but they don't have to pay for it. So you're correct on that. The only responsibility the employer has is to the employee, and it's got to be affordable coverage. And they don't have to offer coverage to the spouse. So please remember that.
Okay, Gary, and our final question.
One more.
Oh, well,
Jennifer.
Okay, go ahead.
Okay.
Sorry.
Maybe Alisa, the first question for
Okay.
Blue Cross in particular, because I have a lot of Blue Cross clients. So if they don't renew until July of 2014, do they keep the plan they have today until July? It was confusing what you guys were saying.
So from a Blue Cross perspective, your plan year should not, it doesn't have to change to January 1st. We're actually going through a process right now to align renewal dates with plan year dates so that there isn't this confusion of when do I get my rates versus when do my benefits change. So that process is underway right now. If you haven't gotten communications, you should talk to your agent or your salesperson about that. But in aligning those two dates, you will experience rate changes and benefit changes at the same time on your plan year date. The requirements are for those things to be effective in 2014, but it is based on your plan year date in terms of when that change has to be in place.
So to be clear,
Okay.
I have a Blue Care Network plan today, deductible 01, and I am a July 1st renewal date for renewal, not plan year.
Okay.
Do I keep that until July of next year, or does that have to change and conform for January 1st?
Are you a large or small employer?
Well, I'm an agent, but I have lots of clients in this situation.
Well,
so.
it depends. If you're a large employer and you don't meet the transitional rule, then the plans have to change as of 1/1.
So everything we've been hearing is your clients are going to be able to keep their rates until their next renewal. So, Answering the question.
Okay.
So
Well,
we'll
you know
talk
what?
after.
We'll make sure you two connect.
No, no.
They want this answered.
I'm sorry, but I'm leaving. No, I got to go back to Chicago.
Because if you're, what is your plan year date? You keep saying your renewal date is July, but what is your plan year
For
date?
small employers, they don't have plan years because they don't file at 5,500. So the renewal date is your plan year. Okay,
Right.
technically that's your plan year.
Or it's the date on your SPD, correct?
Pardon?
It's the date on your SPD.
Yeah,
Right.
if you have a different SPD day, you have to.
All right,
I
let's
think
just
you have
take a
to look
group
at-
under 50 for now, under
Okay.
50. Because you say with Blue Cross, everybody 2 to 50 or 2 to 99 has to change to the new plans. But we've also been hearing, we've been getting a lot of correspondence from Action and everything saying, you will not have to change until your group's renewal date. So,
Yes.
so do they get to keep their plan till July or August or September of the next year and then change to the new,
Yes.
final into the new plans? Okay, that was my question.
Okay. Is everyone good? Okay, who's still confused over here? Okay, take a microphone to them. Let's get this clarified because that's why we're here. Right here and right here, similar. Okay. Okay.
Okay, Larry, you know the question I asked you earlier about the group not conforming because they had less than 25% full-time and part-time employees. So then they have to conform January 1st, even though the renewal is June. Okay, so the renewal is June. Are their rates going to change in January, or are they going to change in June?
Well, in that situation, the coverage would have to be changed if they don't comply with the transitional rule as of 1/1/2014, which means all the changes come into play, and their rates would have to change. I mean, it's up to Blue Cross Blue Shield, but I mean, the coverage would increase by that date because you're subject to all the rules as of that date. You have to have affordable minimum essential coverage as of 1/1/2014. Yeah, right.
So based on all of the communications that we're putting out, we are communicating the changes as of January 2014. What you actually see in your rate package and so forth, it will be based on your plan year renewal date. And those are to be aligned in 2014.
Okay, so if they're not already aligned, they will become aligned. Hang on 1 second.
The taxes and fees are going to be communicated as of 1/1/2014 in your invoice. But as for your entire rates and that entire package of what all of your changes are going to be, that's going to be based on your plan year renewal date, which should be aligned in 2014.
Okay. Wow, that was a hard one. Is it still related to this subject? Okay, let's finish with her, and then we'll go to our final question. Sorry, folks, that was confusing. Woo!
This is for Kristi or Larry. Kristi, I was in your session this morning, and this is for a large employer. You had mentioned if we're on the non-calendar year, which we are, and something about we have to apply for the transitional year, what's it called? Transitional relief for the non-calendar year by December 27th, 2012. If we had not done that.
There's no application.
Okay, so there's something in it says available for the fiscal year plans as of December 27th. So we're still okay. We can still, as long as we meet the criteria, everything's still okay, and we can still have our plans in place as long as we meet the criteria.
The December 27th date that's in there, that's the date that the IRS picked. Basically, your plan had to be in place by that date. Your non-calendar year plan, there's no application, there's no anything formal. Really the purpose for that rule is they wanted to pick a date in the past so that people couldn't all of a sudden say, oh wait, I have a non-calendar year plan, I'm going to change my date now to take advantage of the delayed effective date.
That was the day before the regs were released.
Right, so that's what they wanted to do. Instead of picking, they wanted the plans to already be in place and not provide an opportunity for employers to change their structure to take advantage of a delayed effective date. So that's what, it's basically a snapshot on that date. If you have a non-calendar year plan that was in effect on December 27th of last year and you meet those criteria, those two thresholds, then you would be eligible for a delayed effective date. Does that answer your question? Okay, thank you.
Great. All right, he's been very patient.
Okay, this is a very easy question. The Form 720 and the effectiveness fee that has to be paid in July by self-funded groups, is that still in effect?
Yeah, P Corp.
Okay, that was easy.
I don't think, and maybe it's been released, but the 720 has not been changed yet.
I haven't seen it.
No, the 720 hasn't changed yet, so just relax.
All right. Well, how about a big round of applause for our experts? Thank you. As Don mentioned, we're plowing a new field. Well, there's a lot of boulders and tree roots in the field, isn't there? But we're going to be here to help you through this. We're going to stick with you. We answer your customized questions on a daily basis. Our experts are available digitally through our Healthcare Reform Connect tools. Thank you. Go out and have a great day, and let us know what you need.